Dear audience, dear chair, welcome to my 3 months progress report, and it's my pleasure to introduce you my PhD thesis, which is New Approaches in the Management of Oncological Patients. My name is Renáta Árok, and I am a hospital and clinical pharmacist in the Wojciech Hospital and Clinic, and I am also a first-year PhD student. My vision is that oncological patients could have a better quality of life. Therefore, my mission is to find the most effective treatment and appropriate management of side effects in oncological patient care. Currently, I have 2 specific goals. Which have started recently, and let me introduce you my first topic, which is investigating the efficacy of preventive and therapeutic options for kinase inhibitory therapy-induced skin toxicity. It would be a systematic review and a meta-analysis. So, for the last 2 decades, there has been a tremendous shift in cancer treatment, and taking the data into consideration, we would say that the oncological indication approvals has increased. Moreover, driven by the targeted drugs, and moreover, these drugs are or were in the top-selling cancer drugs in 2022. And as you can see in the figure, kinase inhibitors have the highest number of approvals, but unfortunately, they have the highest rate of occurrence of serious side effects as well, which can high as 90%. And why it is important? Because these serious side effects can or cause interruption to the original oncology therapy, and this therapy discontinuation occurs up to 76%. Interestingly enough, numerous preventive and treatment options exist in healthcare, but there is no consensus about this issue. So my aim is to find the most effective preventive and therapeutic options for this condition. And my clinical question is the same. What is the most effective preventive and therapeutic option for skin toxicity induced by the kinase inhibitory oncological targeted therapy? We consider to investigate prevention and treatment compared to no prevention, no treatment, or placebo, with the outcome of efficacy and the compliance to the original targeted therapy. And our hypothesis is that implementing of skin side effect prevention and treatment result higher compliance to the original targeted therapy. Our implication of the research that early use of the appropriate skin side effect management will increase compliance. Here you can see my search key, and which through I have conducted a systematic search through the 3 main databases, and I have found many key articles, as you can see, mainly related or in connection with 2 main skin side effects: rash and hand-foot skin reaction. And I have found topical, systematic, and prevention and treatment options as well. The key articles, all of them are RCTs. However, as you can see, the intervention options are quite different. But I hope we will or we can pool it in the data extraction part. So the number of articles I found are overwhelmed, but the duplicate remover has completed, and currently I am working on the title abstract selection part. And let me introduce you to my second topic, which is comparing the efficacy and safety of pharmacological therapies for advanced cutaneous squamous cell carcinoma. This would be also a systematic review and meta-analysis. So cutaneous squamous cell carcinoma is the second most common human cancer. Its incidence is 1.8 million per year in the US, which predicted to increase by 50% by 2030. It has two forms, metastatic and locally advanced form. And the current therapies are chemotherapy, targeted therapy, and immunotherapy. Chemotherapy has short-lived efficacy, and the toxicity is often a problem. The targeted therapies are still being investigated, and currently are off-label therapies, and the immunotherapy is considered a newest therapy, and it could be a good candidate for this skin disease, because the higher mutagenicity of the cutaneous squamous cell carcinoma. So my aim is to find the most effective and tolerable therapeutic option for cutaneous squamous cell carcinoma. And the clinical question is the same as the aim of this research. And we will investigate the immunotherapy compared to chemotherapy and targeted therapy with the outcome of survival, recurrence rate, and adverse events. Yeah, and our hypothesis is that immunotherapy is superior to chemotherapy and targeted therapy in this skin disease, and the implication of research is the early use of immunotherapeutic agents can improve patient survival. I have conducted a preliminary research, but my search key has not been finalized yet. So my feasibility of my second project is still ongoing. To summarize my presentation, currently I have two ongoing projects, and I hope it will be submitted in the next year. And thank you for your kind attention. With Eleanor Roosevelt's words, you must do the things you think you cannot do.
Congratulations to your progress, especially in the first topic with so many hits. It's impressive. I would like to ask about second project. Will it be form of network meta-analysis, because you have basically 3 interventions that you want to compare, or you will just compare immuno checkpoint inhibitors to everything else?
Currently, I am planning to just to compare the immunotherapy to the other therapies, but yeah, I will thinking about this your opinion. Thank you for your question.
Congrats, very good presentation. And as a pharmacist, I really liked these topics. I had a question for the first project. So I saw that there were different side effects and different treatment options. So do you plan to do a subgroup analysis? And do you think you have enough data for that? Thank you.
Thank you for your question. Yeah, definitely. We are planning to do a subgroup analysis. As you can see, there are prevention and therapeutic options, yeah, and systematic and topical. So it is worth to integrate these methods. Yeah. Thank you.
Just to the first question, I would like to ask: will you also compare different immunotherapies, maybe? because there are already several immunotherapies available for cutaneous squamous cell carcinoma.
Thank you for your question. Yeah, I haven't considered it yet, but I think it would be a good point of view. So I think I will.
Yes, because there is no question that immunotherapy is superior to chemotherapy.
Yeah, definitely.
It's not a question. That would be the question.
Definitely.
Your question?
Congratulations for the presentation. And I would like to ask about your thoughts on subgroup analysis for the first project.
Yeah, as I mentioned before, I am planning to do subgroup analysis to preventive and treatment option and topical and systematic care as well. And yeah, currently this is my plan. Yeah.
Thank you.
Thank you.